Are you taking supplements to boost your health, or are you unknowingly putting yourself at risk? So the supplement industry is currently booming, but with great power comes great responsibility, and some of us are taking it too far. Hello and welcome back. It's Dr. Ruth here again. So today we are going to dive into the dark side of supplement abuse and explore what is really happening to our bodies that we have no idea. In recent times, beyond healthy eating and regular exercise, many people have turned to vitamins, supplements, and other nutritional products to help enhance their well-being. But while these products are often touted for their benefits, their potential risks and side effects often fly under the radar. Let's shed some light on the dangers of supplement use that are not commonly talked about. What are supplements? Supplements are products that are intended or they are made to make up for nutrients that are missing in our diets, and they come in form of tablets, it can be capsules, it can be powders or liquid drinks. And while all these dietary supplements are good and not in themselves harmful, the problem is when abuse happens. And that is literally what is happening in the wellness industry right now. You feel a certain way, people tell you to take supplements. You don't even feel anything. You are fine. You just think you need supplements. You buy them. And unfortunately, they are not even regulated. They are out there in the market. You can get them over the counter. And while these dietary supplements are good and are not in themselves harmful, they are currently being abused, and therein lies the problem. Now, these micronutrients we try to get from taking these supplements are nutrients that are present in the foods we eat on a daily basis. Is it your rice? Is it your beans, yam, whatever you eat? Most of these nutrients are present in these foods we eat. So it means you don't need to spend extra money because the supplements don't come cheap. They are expensive. I've seen some, I know people that use some, so I know they are quite expensive. So they don't come cheap, but there you have whatever it is you are trying to get from those supplements are things that are present in your normal day-to-day food that you don't have to break the bank to get. The only reason you'll be needing supplements is when you are deficient of these supplements. And how do you know you are deficient? When you exhibit signs and symptoms, just like when you have malaria. How do you know you have malaria, or you speculate that you have malaria? You probably have the symptoms. You feel you're having chills, you're having joint pains, you're having headaches. Then you see your doctor, you go to the hospital where you get tested. Then you are told that you have malaria and you get treatments for malaria. So it's equally the same thing. When you exhibit symptoms, when you start to have some symptoms, maybe you're having some joint pains, you're having some cramping, whatever your symptoms are, you see a doctor. They will schedule tests for you. You carry out tests and it will show if you are deficient of any of these nutrients, and you'll be prescribed those supplements. But if there are no symptoms, there are no reasons why you should take supplements, please don't take supplements. Also, there are certain states that you are in that these supplements become necessary, such as pregnancy state, where women are given the pregnancy care that contains the iron, folate, and then also old age. And with old age, some people may have problems of absorption, and also it can be maybe you've undergone some surgeries such as a bowel resection. In this case, maybe some part of your bowel has been taken out, especially the small intestine, which is necessary for absorption of certain nutrients. It can also be when you are having a chronic disease. Maybe you are having chronic kidney failure. Of course, you know that you need your kidneys for certain vitamins. Also, it can be malabsorption. You're having malabsorption syndrome, so you are unable to absorb nutrients. It could also be that you are a vegetarian. Of course, you don't eat meat, you don't eat animal products. So you may be lacking in some certain nutrients, in which case again you have to see your doctor. You should see your doctor. You have to be tested to confirm that you are lacking in something. So there was a time that was many years ago, I had some cramping, I had some pain around my knee, and it comes and goes, and at some point it got worse. So we visited the hospital, I saw a doctor, tests were carried out to check my serum levels, because we just thought maybe I had low levels of calcium, to check my serum levels, and those tests came out negative. None of those things were lacking, none was imbalanced, none was high, none was low. And of course, I didn't get any supplements, I didn't get any drugs. I was just told to go home, it will stop. And well, in no time it stopped. I don't even know when and how it stopped, but it stopped simply because it was not a nutrient deficiency. That was not my problem. Maybe it was something else that was the problem. But the point here I'm trying to make is that it was not a nutrient deficiency. So I wasn't even given anything. That is after being tested. And also bear in mind that whatever we take, whatever we ingest, our liver has the burden of metabolizing it, our kidneys have the burden of excreting it out of our bodies. So when you are taking what you don't need, what is not necessary, you are only overworking your liver, you are overworking your kidneys, and you are putting them in a position that is not good. And we know what it has been like lately with young people. I don't know if it's just me, but I have noticed a rise in the cases of kidney failure among young people of recent. And again, most of these nutrients are needed in very minute quantities. And as I mentioned earlier, we are already getting whatever we need from our daily diet. And not forgetting that sometimes we even get more than the body needs. So our body excretes what is not needed, because some of them are stored while some are not stored. So if you are not exhibiting symptoms, or you don't fall into the aforementioned categories, the categories I mentioned earlier, please don't put yourself in a situation, because you are doing more harm than good to your body. In my next video, I will talk about commonly abused supplements and what that abuse will result in. So if you have any questions or clarifications, please do leave them in my comment section and I'll be happy to respond. If you also found this informative, please subscribe to my channel so that you can get more of these. Thank you.